people who use prescription opiates non-medically get them for free from a friend or a relative. So it's just saying that if you know somebody, it's very accessible for you to get it if you have friends or family members that are prescribed the medication. Social determinants of health. It just shows a cycle of how economic stability, neighborhood and built environment, health and health care, social and community context, and education all it's a cycle of the factors of the neighborhood where you live and your ability to be able to receive the proper health care that you need, and how one social determinant influence another. Social determinants of addiction. Um, you might live where there are few economic opportunities and a high availability of opiates, which usually happens, and your friends or family members are usually casually, and it's a big part of your social life. If it is a big part of the social life and at the same time you are suffering from untreated medical health problems that have been bothering you, ultimately you're going to be much more likely to start using opiates. So you have these individual factors like age, gender, and mental health conditions and your genetics, but that only tells part of the story. There are still interpersonal factors, community factors, and social factors that play an enormous role in your life that will have you becoming a victim of addiction to opiates. Opiate misuse in rural areas. There's a shortage of primary care providers. Opiates are prescribed more commonly in rural areas. Close rural kinship networks, our migration of young youth, and opportunities for description of prescription drugs. Opiate misuse in rural areas is continued because lack of job opportunities, poverty, and job opportunities are often close to those with criminal records. Also, you have to consider childhood instability such as trauma or exposure to drugs and alcohol. And earlier childhood trauma and exposure to drugs and alcohol is associated with higher chances of developing a substance use disorder later in life. Social factors contributing to opiate misuse. You have drug sharing and adequate treatment, no job opportunities, youth out migration, and large social networks. The opiates are being shared across the lines of age and spread through large social networks, and those who do ultimately become addicted have fewer choices for entering treatment. There's also stigma, which is associated. Stigma occurs when societal attitudes about a condition negatively impact how people view individuals with that condition. Stigma occurs at many levels and can make people less likely to talk about issues that are bothering them. Stigma is one possible explanation of why only 16% of adults with substance abuse disorder receive specialized treatment. It's often really difficult to even talk about needing help for a substance abuse disorder, and there's so much negative connotation in regards to drug users and how the environment has contributed to drug users and how they're looked down upon and stigmatized. Stigma helps to explain how so few people with a substance abuse disorder actually do not seek out treatment. Community health workers. Community health workers, or the LPCs, the psychiatric nurses, the psychologists, the psychiatrists, the any type of aides, anyone associated in the healthcare industry. They are in a position to address some social determinants of opiate misuse. They can recognize opiate misuse in its early stages, help clients navigate the complex treatment system, break from societal stigma by being non-judgmental source of support, and know how to reduce harm among people struggling with opiate misuse. Recognizing opiate misuse. Some signs that the community health worker might recognize could be noticeable excitement or euphoria, unsensational sedation or confusion, doctor shopping, sudden financial problems, and physical withdrawal symptoms. Okay, noticeable excitement over euphoria. Euphoria is physical withdrawal symptoms in the euphoria is the experience or effect of pleasure or excitement and intense feelings of well-being and happiness. Certain natural rewards and social activities such as aerobic exercise, laughter, listening to music, or making music and dancing can induce a state of euphoria. Unusual sedation or confusion. Doctor shopping is where the most doctors that are abusing the use of opiate addiction as well, they only let the patient come see them one to three times without a MRI or an X-ray to justify the needing for prescribing those strong medications. And we see that a lot where the doctors are consistently getting busted by the feds because of this issue. A major social non-judgmental relationship is a major social determinant of prolonged substance use and stigma. Community health workers should work to foster an environment that does not stigmatize the client so that they can openly discuss their relationship with substances. Some tips would be to avoid confrontation, express empathy, and talk to your clients about their goals. Treatment options for addiction. There are many treatment options for opiate addiction and mixed use, which is supervised detox, inpatient/residential care, long-term outpatient care. And because opioid use has a long-lasting effect on the brain, recovery often requires medication to produce the best outcome. Supervised detox, since the cravings are still there, but the tolerance to the substance has been reduced. Supervised detox may be helpful for some of the other substance abuse use problems, but it is rarely the best choice for opiate dependence. There is inpatient and residential care, which is longer than supervised detox and usually involves some group work and individualized care. Please remember that recovery from opiate addiction is a long-term process, so typically someone will want more long-term care in outpatient setting to get continuous support throughout their recovery. Medication-assisted treatment, also known as MAT. There are three medication approved for treating opioid use disorder, which is methadone, buprenorphine or Suboxone, and naltrexone. A study showed that medication-assisted treatment increases treatment retention and decreases the risk of overdose. Despite the supporting evidence, MAT which is medical-assisted treatment, is still controversial among the public and some medical providers. And you can see how methadone, buprenorphine, and naltrexone works. Suboxone is buforamine, which is also known as Suboxone. Suboxone is similar to methadone, but it's more difficult to abuse because its effects plateau, so that after a certain point, using more will not increase the effects. But Suboxone and methadone last much longer than the opiates that are commonly abused, like oxycodone and heroin. So they help the person begin to experience fewer extreme highs followed by extreme lows. The third medication is called naltrexone, which blocks opiate receptors entirely, meaning that opiates will not have an effect. This treatment is less popular since it does not help with withdrawal symptoms. Clients not seeking treatment. Clients decide whether they need to enter treatment at various stages in the substance use disorder. It is important to work to keep these clients safe even when they are actively engaging in risky behaviors. This is a harm reduction, and so with the harm reduction you have collaboration, respect, acceptance, empowerment, and compassion. All five of these have to be in retrospect in order for it to work successfully. Overdose prevention tips is they have a lower tolerance due to not using for a period of time. They mix opiates with other substances like benzodiazepines or alcohol. They are using opiates alone. They have a new source of opiates, and they have overdosed in the past. The benzodiazepines or a class of drug primarily used for treating anxiety, but they have also are effective in treating several other conditions. Common drugs, which you would see in the picture, or Xanax, Ativan, clopidogrel, and Valium. Naloxone is a medication that can be administered to reverse an opiate overdose. As you can see in the picture, it's administered as a nasal spray or as an intramuscular injection and cannot be used for any purpose other than to prevent an overdose. In this video, it's going to show how there's an epidemic going on where people are in a drug crisis, where this person on heroin has overdosed, and they are giving them the naloxone in order to resuscitate him. As you can see, this is a Liberian, and she is talking about how she is on the front line, and they have a team that comes to this park and picks up all of the needles that for the heroin addicts in the area.
Philadelphia this year up 32% from last year, and the park surrounding the library has become a focal point.
The opioid crisis, the heroin crisis was knocking at this library's front door. It was camping out on its lawn.
Philadelphia Inquirer columnist Mike Newell started writing about it when he learned of a big increase of people.
Okay, in conclusion, although opioid use disorder is a medical condition, not all of the contributing factors are medical. But by knowing the environmental factors that contribute to opiate misuse, community health care workers can help make the path to recovery easier for their clients. A non-judgmental attitude is critical for helping individuals with substance use disorder and for combating stigma overall. Recovery is a team effort. You must engage family members, friends, and loved ones for additional support. As you can see, my little cute road to recovery. Questions or comments? My contact information, if you still have unanswered questions, is I can be reached by email at ms_sharonda, which is SHARONDA _